Good evening. It's 8 o'clock. Well, NDTV is focusing its prime time specifically on what's happening with the Omicron global variant. Sarah and Vishnu will be joining me with all the latest updates, both on global restrictions and what's happening in India, especially in terms of health and travel. Let's just look first at the top headlines. The World Health Organization warns that the overall global risk linked to the Omicron variant is very high. Says an unprecedented number of spike mutations in Omicron is what is causing worry. However, they add that no deaths have been reported of this variant so far. Meanwhile, Japan stops all international flights to the country, the third country to do so after Israel and Morocco. And Moderna and BioNTech vaccine manufacturers say we will have a vaccine for this variant by early next year. So what does this mean for India? The Prime Minister warns of increased caution for this new variant. Meanwhile, the new rules have UK and Europe as at-risk nations, not the United States. That means international travellers from these countries will test at the airport and wait for the airport test. Plus, of course, they have to have a 7-day quarantine in hotels or homes. The South African doctor who raised the Omicron alert is on NDTV tonight. She says that the symptoms she's seen are extremely mild, include extreme fatigue, and all her patients recovered without hospitalization. But she doesn't know the long-term consequences on vulnerable patients. In other news, the farm laws were passed without discussion last year. Today in Parliament, they were repealed without discussion. The opposition protests, but meanwhile, a new flashpoint as 12 opposition MPs suspended for unruly conduct in the last Parliament session. Tamil Nadu reels still from unprecedented November rain. Chennai's rain was almost 3 times the normal in November. In fact, it's almost two-thirds of the monsoon, its entire monsoon. Our special report on how the city is coping. Well, our lead story tonight, dominating the headlines, is the new Omicron variant. And Sarah, the World Health Organization just released a statement outlining what it sees as the risks of this new variant of concern.
That's right, Sonia. The latest on this really is that in the last 2 hours, Sonia, the number of countries that have reported cases of this new variant has gone up to about 17. That's what the Washington Post is reporting, and this even as the WHO reassessed its assessment of this Omicron variant. They had initially said that not enough was known about this variant, about its virility, about its transmissibility, but now they're saying that the global risk assessment of this Omicron variant is very high. Now that really, Sonia, is because this variant has many mutations, about 26 to 32, and mutations are what make it easier for a virus to latch on to the human body. So the WHO is now saying in its new assessment, updated assessment, which is the latest news at this point of time, is that if there's a COVID surge driven by Omicron, the consequences will be very severe. The impact on vulnerable populations will be very severe, especially in countries with low vaccination rates or coverage. But Sonia, it's also important, I think, at this point of time to point out that until now, there have been no deaths reported that are related to the Omicron variant. But given the spread of these cases across continents, perhaps it is understandable, perhaps, to see how governments are reacting the world over, because the WHO doesn't advocate bans and closing of borders. They have said that the scientific response needs to be more sequencing, needs to be more testing, etc., not closing down of borders. Yet that is exactly what we're seeing on the ground. Japan and Israel have banned all foreigners. The US and Singapore have banned foreigners from about 7 to 8 countries. Australia has changed its plans. They were just about to open up their borders to students and workers again. So this pandemic really has once again emphasized and highlighted the necessity and the challenges of global cooperation in containing a virus that really knows no borders.
Right, because in fact, you're right that the WHO also called for what must be a pandemic accord, and also highlighting the differences, the inequity in vaccinations globally. Africa, for instance, amongst the lowest vaccinations of all continents, and the point being made that if no country is vaccinated fully. No country in the world is safe. So, Vishnu, let me go across to you, because of course the Prime Minister today urged caution as we deal with this new variant, and India has announced new guidelines as well. We're not stopping, we're stopping short of actually closing down our borders and stopping international flights, but there's huge worry that this could happen. What's the situation currently, and will our airports be able to handle these new restrictions?
Well, despite assurances that our airports will be able to handle thousands of passengers who will need RT-PCR tests upon arrival before they are allowed to exit the airport, there's a very real worry that there could be chaos when the new travel regulations come into effect from the 1st of December. Let me explain why. Now, what you're going to see over here, this explainer, pertains primarily to travellers who come to India from countries designated at risk. Now, these are the countries: European nations, including the UK, South Africa, Brazil, Bangladesh, Botswana, China, Mauritius, New Zealand, Zimbabwe, Singapore, Hong Kong and Israel, America missing over there. So let's talk about these countries. Before you arrive, you have to fill and upload both a self-declaration form and a negative RT-PCR test result on the Air Suvidha portal. Once you arrive, you do an RT-PCR test on arrival and cannot exit the airport till your report comes. That could take several hours. What happens next? If you are negative and are allowed to exit the airport, you go into home quarantine for a period of 7 days. You then do a retest RT-PCR on day 8. If you test positive on day 8, then it is strict isolation and genomic tests to identify Omicron. On the other hand, if you test positive at the airport itself upon arrival, your sample is immediately sent for genomic sequencing. You are admitted into an isolation facility from the airport itself. If you are identified with Omicron, once your genetic sequencing comes back, then there is very strict isolation until you get better, a doctor decides. But the bottom line is this: it is absolutely critical for our airports to have the facilities in place to ensure thousands of passengers are efficiently tested and social distancing is maintained. And finally, if you are not from an at-risk nation, you are free to leave, but 5% of travellers may be random tested as well.
Right, and of course, that's the latest update today as of November the 29th. But remember that many of these rules will change depending on the changing situation. So you need to be updated on what's happening. The Prime Minister today, before Parliament began, spoke of the need for caution. This as India's cases are still relatively stable at just above 8,000. But as we know, after we saw the Delta second wave, that could change rapidly. We need to stay on alert.
नए वेरिएंट की खबरें भी हमें और सतर्क करती हैं और सजग करती हैं। मैं संसद के सभी साथियों को भी सतर्क रहने के लिए प्रार्थना करता हूं। आप सभी साथियों को भी सतर्क रहने के लिए प्रार्थना करता हूं, क्योंकि आप सबका उत्तम स्वास्थ्य, देशवासियों का उत्तम स्वास्थ्य ऐसी संकट की घड़ी में हमारी प्राथमिकता है।
Also, what exactly is Omicron? Well, for those of us who don't speak Greek, it is the 15th letter of the Greek alphabet. Interestingly, the WHO actually skipped 2 letters, Nu because it sounded too much like new, and G because it sounded too much like the Chinese premier's name. Here's actually the explainer on what Omicron is and what you need to watch out for.
Omicron, the new variant of concern that has the world on alert. 3 questions that need to be answered as of this moment. 1, is it more transmissible than say Delta? 2nd, does it cause more severe disease? And 3rd, is it showing any sign of immune escape? We spoke with experts and these are the answers. On the question of transmissibility, data coming from South Africa suggests that Omicron is more transmissible and outcompeting the other faster spreading variants like Delta and variant. Why? Because it has a cluster of mutations in its spike protein which is associated with the entry into the cells. More efficient entry means more and increased transmissibility. Let's get to the second question then, the all important of how severe the disease will be. Too early to say what really this variant will mean, but the South African doctor who actually treated several patients with Omicron and alerted the authorities about this in the first go talks about the symptoms being unusual but mild. She goes on to say there is no loss of smell, no loss of taste as well, and no major drop in oxygen levels with Omicron. So far, it is seen affecting people who are 40 or younger. Number 3, does it show any sign of immune escape? Now, this is where we know very, very little. Will Omicron evade immunity, pre-existing immunity? What about its effect on antibodies generated by natural infection or those by the vaccines, and also the killer T cells and the ability to control infection? All these answers we do not have currently. Next 2 weeks are going to be crucial in getting us these answers. And then the all-important question of mortality. So far, the world is watching out for this variant very, very carefully, but no deaths related to Omicron have been reported. Also interesting is the name of the variant itself. The WHO has been naming coronavirus variants after Greek alphabets, but in this case, they skipped 2 letters, Nu and G. Experts say this is because the alphabets were a little confusing. Nu was confused or could have been confused with the English word new, and Xi has been avoided so that the name is not misconstrued as a reference to the Chinese Premier Xi Jinping.
Thanks so much, Sonal, for that explainer. So all we know now is that we don't know, but we need to be on high alert. So what are vaccine manufacturers saying? So vaccine manufacturers Moderna and BioNTech have both come out with statements saying that they're working to adapt their current COVID vaccine to address this variant, and they expect to have a new version, Moderna says, by early 2022, and BioNTech says within the next 100 days if necessary. So good news that vaccine manufacturers already looking at this variant and how to tackle it. Well, let's just take a look at the other big headlines. Well, a year ago, the farm laws were passed in Parliament without discussion. Today, they were taken back without discussion. Again, a sad commentary there on how exactly bills are being passed and repealed in this case, but also a flashpoint about 12 opposition MPs being suspended today because of their unruly conduct in the last session. This apparently based on CCTV footage, but the MPs have protested, saying that they weren't asked for their side of the story. So that's really going to be the big opposition flashpoint from tomorrow.
Item number 14. Shri Krishi Mantri Ji.
Farm Laws Repeal Bill passed in the lower house in 4 minutes without discussion by voice vote, despite the opposition demanding a discussion on the bill.
तो जब कॉन्फिडेंस है पासिंग की सवाल आते हैं तो चर्चा क्यों नहीं किया जाएगा? अरे सदस्य इसके पक्ष में आ गए, अरे कांग्रेस वालों सदस्य विरोध में ना गए। मेरे विचार में निर्णय हाँ वालों के पक्ष में।
But the government didn't agree, even though just a short while earlier, the Prime Minister said they're ready for all questions.
सरकार हर सवाल का जवाब देने के लिए तैयार है।
प्रधानमंत्री ने ये एक्सेप्ट किया कि उनकी गलती के कारण से 700 लोग मारे गए, तो फिर अगर उन्होंने गलती एक्सेप्ट कर ली है तो फिर कॉम्पनसेशन देना तो पड़ेगा।
In the Rajya Sabha, the bill was passed in a few minutes.
सत्ता पक्ष भी जब इसके लिए तैयार हो गया तो मैं समझता हूँ ये विषय रिपील करने का सर्वसम्मत विषय था।
डिस्कशन हो सकता था, चर्चा हो सकती थी, लेकिन जाहिर है कि ये सरकार चर्चा नहीं चाहती।
The government managed to pass the very important bill on the very first day of Parliament without any discussion, as the opposition stood divided in Parliament. Both the Congress and the Trinamool Congress demanded the same, discussion on the Farm Laws Repeal Bill. But both the parties protested separately, both inside and outside the House.
सरकार नहीं है, सरकार तैयार नहीं है, इसलिए हम लोग इसको प्रोटेस्ट कर रहे हैं।
Even the opposition party strategy meeting called by the Congress in the morning, only 11 parties attended it, while the Trinamool Congress, the Samajwadi Party, RJD stayed away, exploding cracks in the opposition unity. This is one of the fastest repeals that we have seen in recent times, but clearly the focus will be on whether Parliament will function. With an opposition disunited, clearly the government wants to take the upper hand. But the fact remains that with the suspension of opposition MPs, whether all will go smooth now. With camera person Sashikant, Sunil Prabhu, NDTV.
Well, let's go across to other news now. Let's go across to Tamil Nadu and Chennai, where 80% of the entire rain this monsoon has happened in just this November. In fact, it's almost 3 times the normal. Let's just look at the latest from there, the visuals from Chennai. Look at what it's like there as heavy rain has continued. These pictures, of course, when the rain has stopped, but you can see just how much waterlogging there is in Chennai with that unprecedented November rain. We'll take a quick break now, but back with lots more right after this. Welcome back. We're joined by our special newsmaker on the 8 o'clock news tonight. I'm joined by Dr Angelique Curtis. She's a physician in South Africa and also chairperson of the South African Medical Association. But of course, also the doctor who first raised the alert over the Omicron variant. Dr. Curtis, thank you very much for joining me this evening on NDTV. I just wanted to ask that you actually have had first-hand experience of seeing patients with Omicron. Tell us about how you first spotted this and what you identified as the symptoms.
Good afternoon, and maybe it's good evening at your side.
Yes.
Yeah, so I think it's important to understand that when we first now starting to see these patients, it's mild symptoms. It's not the same symptoms than you normally will see with the Delta variant.
Mm-hmm.
What we call mild symptoms is like fatigue, sort of a scratchy throat. It's not really a sore throat. Nothing with the nose really going on. They're not complaining any of with stuffy noses. And what we call body aches and pains and a bit of a headache.
Mm-hmm.
So that would also fall under the term, medical term malaise. That's, and not really having a temperature. I've seen about 2 children with a temperature,
Mm-hmm.
but it's mild symptoms and totally different from your COVID, your Delta variant. And I think what is important to understand when we say this is mild symptoms, we're not saying you don't need to go to the doctor. We're actually encouraging you to go and see your healthcare worker to make sure that these symptoms that you think is actually not of any importance might be the Omicron already been there, and you might spread that variant
Mm-hmm.
to other people who is unvaccinated and cannot afford it. So when we say it's mild, yes, we are saying, please don't be at this stage too alarmed that everyone is going to die from this variant. But also don't just think this type of infection I have will just get better on its own.
Right.
Please go and make sure. That's the reason why we keep on saying it's mild symptoms as well. One of the reasons.
And Dr. Curtis, because as you said this, the World Health Organization today issued a statement warning that consequences, the worries of transmission of the Omicron virus could be very severe if we let it go uncontrolled. This comes, of course, when we're seeing country after country imposing very severe travel restrictions, especially against South Africa. Do you think that's really the right response? And actually the data coming out of South Africa is what has worried people in India as well, that in some provinces the Delta variant is being replaced by the Omicron variant in a very short span of time. So the transmissibility, even though mild, seems very high.
Yes, we're not disputing the transmissibility. We think it is maybe, for now it's difficult for me, that's a clinician, to say it's worse than the Delta variant, but it's just as transmissible than the Delta variant, at this stage of the game. And the scientists will tell you it might be more, and that's fine. The fact it is transmissible, and it's more than the Beta variant was before. So the severity of the disease, it depends on, and I think this is where the whole confusion or the whole hype is coming in, because of the 30-odd mutations it's got. people don't know what to do with this virus. They don't know what's going to happen going forward. We can only say to you what we are currently experiencing. And so within the next 2 weeks from now on, we will know with the data that we would then have, is it escaping the vaccines? Is it escaping our acquired immune? And do you see only breakthrough infections not really escaping the vaccines, or people who have been previously infected? What is the reinfection rate? And if it's reinfected, how bad clinically these patients would be? Right. So in the end of the day, it goes about how severely affected people are who would be in need of hospitalization. So the mere fact that we say it's a mild disease doesn't take it away that you're not going to feel sick. You are going to feel sick. But it seems to be very much self-limiting, if you, after you have told the patient what to do, and you assist the patient. Right. But for now, we don't see that there's oxygen needs or ICU needs. It's not there yet on the type of patients that we encounter at the primary care level. I'm not talking about patients lying in hospital and whether they are already being sorted as whether it's Delta or Omicron. That's hospital level, but we also haven't seen an increase in hospitalization.
So that's a very encouraging sign. You're saying that right now, and of course you chair the South African Medical Association, that at the primary healthcare level, and even in the rate of hospitalization, you're not seeing a surge similar to the surge we're seeing of cases. So hopefully that may be a silver lining.
That might. And it might stay like this. And it might change within the next 48 hours.
Right.
But that is this type of virus that we're working with. And so we're just saying to the world out there, listen, yes, we know we see these people. We know our infectivity rate is going up. But let's step one step back, take one step back, and let us just see what is going to happen before everyone go into a hype, closing borders, affecting other people's lives. And we still haven't worked this out. And it's not a South African disease, it's a world over disease. I'm quite sure it's in other countries as well. And we have already seen reports coming from other countries that it's there.
Yes.
So, but because South Africa spoke up and told the world what we are seeing, and then again on clinical level at primary healthcare, we're saying, guys, what we are currently seeing is not in relationship with the hype. We're not saying it's not going to change.
No, and that's the right thing to do. The transparency, I think, is something that you need to, South Africa and doctors like you need to be praised for, not something which is seen as a punishment. And I think the irony perhaps, Doctor, also is that when we looked, the world's attention is suddenly being drawn to Africa and the vaccination levels, even though South Africa is relatively higher than other African countries. And I think that's the point, that as a doctor, when you see that certain countries, richer countries have vaccines, make sure their population gets it and other countries are left out. That's what happens today then. And you then look at global shutdowns because, of course, people travel and citizens travel to other countries as well. So you can't safeguard your country without making sure there's equitable vaccinations. Did you see Omicron more in unvaccinated people rather than vaccinated? Is that just from initial data so far?
So far, yes, especially today, seen it in younger people. I've seen 3 people under the age of 13. Not very severely ill. They're not, they're not feeling well, but they're not deadly sick. And and I sent them all home, and I think we can manage them at home. We will follow up tomorrow and see how the children are. And then the other people were young people under the age of 40 that I've also seen 2 new ones there today. Again, not very severely ill, but it might change.
Right.
So we're trying to say, don't miss these people while you are looking for Delta signs, and you actually miss the Omicron, which might spread quite fast, which might bite you going forward because you didn't look at the symptoms.
So you would say that people must get vaccinated even with current vaccines available, because that would help. And of course, this important point that it is getting picked up in COVID tests, that you are COVID positive even if you have the Omicron variant.
I really think so. At this stage, you need to vaccinate. You need to wear your mask, stay away from crowds, stay away. And that is the simple things that we have been saying how many times before. And people don't really hear what we are saying. And if your country's got a policy that you need to go and get a booster vaccine, go and get it. That's your country's policy. There's no guarantees that if you take the vaccines, you will never get sick. But we're trying to get people out of hospital. We're trying to say the vaccines are there to prevent you from getting severe disease. The vaccines are there to try to keep you healthy so that you don't die and that you get mild disease, so that we at primary care level can treat you with those mild disease.
Dr. Curtis, as I said, this is a time when you're really in the eye of the storm, but I know that you are at that every day at the front lines, all primary healthcare workers and hospital workers. Thank you very much for joining me tonight from South Africa. It is a fascinating discussion, and thanks for your first-hand perspective. Thank you once again.
Thank you so much, and please stay safe.